Welcome, everyone. I am Bonnie Bell. I'm the Director of Brand Management here at BLBB Advisors. We have a very educational program for you today with our friends from Caribou on Medicare Open Enrollment 101. BLBB is proud to extend our reach by offering partnerships with third-party providers like Caribou that offer additional services that address our clients' needs. And financial planning often drives decision making, but it also involves a large number of assumptions including healthcare considerations. But how do you plan for healthcare costs without really understanding what your options are? We have Clarice Fleming joining us today from Caribou to address that exact question over the next 40 or so minutes, which includes answering any questions you may have that you can submit to her through the chat feature. Caribou provides a healthcare planning solution, and Clarice is a health planning coordinator with Caribou and has over 20 years of experience in the industry. She works with clients of financial advisors to assist in the healthcare planning and education. And Clarice helps to empower our clients to confidently navigate a sometimes complex industry and make informed decisions that benefit your overall well-being. All of our registrants today will get a copy of this program, a recorded copy, so you can refer back to it. And if there are other suggested topics you have that are of interest to you, please contact me at bbell@blbb.com with your suggestions so that we can make sure that our program is relevant to your interests. And of course, we ask that you follow us on our website and LinkedIn to stay current on the information that we're providing. At the conclusion of this program, we also suggest that you follow up with your BLBB financial advisor so that you can get started and taking benefit of what the program that Caribou has to offer you. So with that, I'm going to have Clarice get us started.
Thank you, Bonnie. It was a great introduction. And yeah, I want to echo if anyone has a question at all, the chat box is in the bottom right hand corner. There's also a questions box as well. I have colleagues on the line with me who may be able to answer live. They might actually type back a reply, but any questions that are in there, I will also try to address at the end of our presentation. I'll try to get through all of the questions. So we do encourage that interactive thing. As Bonnie said, I'm a health planning coordinator. I really am an education enthusiast. I really love the opportunity to provide information and education so people can plan and prepare and not have huge financial surprises. We want to avoid shocking hospital bills or unplanned expenses. So from that aspect, I'm very passionate about this opportunity to come speak to you and just give a little bit of information and knowledge to help support your planning process. We have a lot to get through, and I will kind of cover the basics. Why is Medicare planning so important? How does it benefit me? Understanding Medicare basics, getting a foundational knowledge of how Medicare works so that you can navigate expertly through the choices and options that you have, how to pick that optimal coverage. So you have two plans next to each other, side by side. How do you know which is better? Which one covers more? Which one is cheaper? Which one has a better rating? And I'm going to give you the tools necessary to be able to make those plan comparisons and really pick an optimized health coverage for you and your family. And then finally, so you've picked a plan. Now what? What are the next steps to get enrolled? So we'll go through all of these today. There are a lot of life events that affect healthcare. Maybe getting married, having a new baby, you've moved to a different state, you're retiring and leaving your work and your employer coverage that you've had for many years. But the life events I'm going to focus on today are the ones that surround Medicare choices. So you could not yet be 65, but you're interested in looking at the costs. I wonder, what is my healthcare going to cost me when I retire in a few years' time? Or what does that look like for me as I approach 65? Maybe you are turning 65 sometime soon, this fall or next spring or next summer, and you want to start making actual tangible plans about your healthcare coverage. You could be turning 65, but you're not retired. Maybe you want to delay Medicare. You're happy with the employer coverage you have. You've done your comparison and you know that it is the most optimal plan for you, and you're ready to delay Medicare. But does that require an effort or any steps to actually go through and do? We also have starting Medicare at 65. If you've already worked until 67, 68, 69, and you're ready to retire, but you're in that Medicare eligibility age, what does that look like? And then let's say you're on Medicare right now. You have it and you're wanting to review it during open enrollment. You're wanting to say, hey, is this the right plan for me? Maybe there's a new plan that came out that's better. Or maybe I wasn't sure when I first enrolled. I kind of just picked the one that I knew, but maybe there was something else I could consider. So there's a lot of different life events that might inspire you to ask questions around healthcare planning, and that's why we're here. Why is open enrollment specifically important? Well, everything can change. The premiums that you pay on a monthly basis to purchase your health insurance can go up. They often do. Out of pocket maximums, so the amount that you're exposed to in your deductible or co payments, that is what we consider the out of pocket maximum or the financial risk, could change and fluctuate. Deductibles change. Provider networks. Your provider might be in network one year and choose to retire or go out of network the next year. So you may find a fluctuation in the doctors and services available. Drug formularies absolutely change on a yearly basis, so your prescription medications have a variable fact, and which pharmacies are preferred or in network can change. So, all of these things help influence why open enrollment is a critical time to just reevaluate and reassess on a yearly basis. Drug prices increased 35% between 2014 and 2022. The overall medical services for like medical care increased 21% in that same window. So healthcare is going up in costs. 95% of seniors with Medicare Part D drug plans overspent on their coverage last year. And these are quotes from the GoodRx Financial Advisor magazine. So while drug costs are going up, a huge portion of people aren't reviewing their plans and could have actually had something cheaper, for the same coverage. So, with that, let's talk about the basics of healthcare, basics of Medicare 101. How does Medicare work? What are the options available to me? Medicare has like a fork in the road. On the left, you can see Original Medicare, which was created in the 1960s. I think Lyndon B. Johnson was the one who signed it into law. It includes Part A, Part B, and then you can opt for like a Medigap or a Part D drug plan. So think of the left-hand side as being like a menu, and you can choose different components from different plan options to configure a meal. So you might have an appetizer, you might have a main dish and a dessert course, but you're pulling different selections, and what one person chooses and what another person chooses might be two entirely different meals. So you and your partner might go out to dinner and order something completely different, but you can configure it as you like. The other option, Medicare Advantage on the right, all bundles into one. It's also known as Part C. And Medicare Advantage will include Part A and B. It often includes a Part D drug or prescription plan, but it kind of bundles everything together with one plan and one RD card. Think of that more like if you went to like a pre-theater dinner where it said, or a prefix like a New Year's Eve dinner where it says, this is our menu, first course, second course, third course, and you pay a flat rate and this is the dinner you get. So it kind of bundles it for you, but it can offer some optimal choices in there. And we're going to talk about both of these options. So Part A and B, which is covered under both options, was what was created in the 1960s. Part A is usually free. It's coordinated through the Social Security Administration, and it's free if you've paid your Social Security taxes for up to 40 quarters, or essentially almost a decade, 10 years. And if you paid those Medicare taxes on your paychecks. It covers facility-based care. So these are health services, hospitals, nursing facilities, hospice care or home health services. Facility-based care can also be laboratories. So if you had like a blood work done at a lab, or if you had like an MRI or a CAT scan, these would all run under your Part A. Part B has an income-based premium, which I'll explain in a moment, and it covers the professionals, the doctors you visit, the specialists, and like a cardiologist, endocrinologist. It'll also cover vaccines and wellness visits and durable medical equipment. Interesting point. It's all one Medicare card, red, white, and blue ID card for Part A and B that everyone gets when you turn 65. If you went to the hospital for a surgery, both Part A and B would be engaged. Part A would cover the building, the hospital, and the surgical room, and the nurses and the team that were there. Part B would cover your actual surgeon and their anesthesiologist. So you have two components on one card that's kind of covering the basis. I mentioned that Part B is income-based premium. It's known as IRMA, which stands for Income-Related Monthly Adjustment Amount. In very simplistic terms, because I know that acronym is quite a mouthful, it basically means that your income is in brackets, just like when you pay taxes. If you earn a lot of income, you're going to be in a higher bracket. And those brackets equate to a monthly amount that is attached to your Part B or your Part B Medicare. So you can see Part B and also actually Part D has an IRMA charge or income adjusted monthly amount. And you can see the different income levels on the left and how it goes up or down depending on the amount that you make and the amount that will be charged on a monthly basis. This is important to know as well. It's a 2-year look back period. So right now in 2023, for anyone who's on Medicare, they're looking at your income from 2021, which is a modified adjusted gross income. If you're enrolling next year in 2024, you're going to use your 2022 modified adjusted gross income. So that 2-year look back period can change a lot in retirement. You may have been making a great income in 2022, but when you retire, your income might shift dramatically. That's when an IRMA appeal will come into effect. And you can file to have your IRMA reviewed and adjusted if your current income today is not the same as it was, and the payments need to be adjusted on that basis. So Part A and B, that facility and professional coverage, only covers 80% of a claim. So let's say, for example, you went to the doctor for a sore throat and it was $100. Your Part B Medicare would cover $80 and you'd have a $20 responsibility. Obviously, that's not a concern to anyone, but if you had a $10,000 surgery, you're on the hook for $2,000. And that's the part that people tend to look for other coverage. They tend to say that's too much financial exposure. And so the Medigap was born. A Medigap or supplemental plan is exactly like it sounds. It plugs the gap of that 20% or supplements the insurance. So what a Medigap is essentially it's buying extra insurance to provide yourself additional coverage and reduce your financial exposure. If you've ever rented a car when you're traveling on vacation and they ask you, would you like personal protection insurance and roadside assistance and the navigation system and protection of your properties and valuables inside the car and all these other things, you can add on little pieces to make a huge comprehensive car insurance, or you can just get the basic required by law. This is kind of like that. It's adding on extra medical insurance to fill the gap of your coverage. Medicaps are sold by private companies. They must follow very specific rules and guidelines, and there's 12 lettered plan options available in most states. Some states work it slightly differently, but most states do the 12 lettered plans. The most common that you're going to see sold today are Plans G or a high deductible Plan G. Plan F or a high deductible Plan F was available to anyone who turned 65 prior to 2020. They're no longer being sold to new enrollees today. And then Plan N as well. So let's look at some of these lettered plans. On the left in dark blue going down, you're going to see a row of the things that A and B Medicare do not cover. They don't cover Part A coinsurance, which is the 20% if you had a $10,000 surgery. They don't cover Part B coinsurance, which is the $20 bill if you had a sore throat visit with your doctor. They don't cover 3 pints of blood, the coinsurance for hospice care. There's a few things on that list. And as you look across the top going to the right, you're going to see all the different lettered plans, A through N. The green check marks means that your Medigap picks up that cost. If you look at Plan G, for example, which is the most common plan sold today, it covers all the green checks except for one, which is the deductible of Part B. So that's all you have to worry about is your deductible. The Medigap picks up everything else. So that's what I mean by saying purchasing extra insurance to just give yourself additional coverage and peace of mind and reduce your risk exposure. All of the plans with the same letter have the same benefits, which means if you have a Plan G from Allstate or a Plan G from Humana, those two Plan Gs are identical, One Plan G to the next Plan G are exactly the same. They are required to cover the same things. So it's only if you choose a different letter that you're actually getting different coverage. Plan G, again, the most common. Plan N is sometimes suitable for people with lower healthcare utilization if you have a strong preference for low monthly costs. And I'll go back to this chart and show you Plan N is that far right-hand side. It has one more red X than the Plan G, and that's for Part B excess charges. So it doesn't cover excess charges, but it can have a lower monthly premium. So sometimes people feel inclined to choose that plan because it is more cost effective out of their monthly pocketbook, and then they can face excess charges if or when they apply. High deductible plans are also an option if you're interested in a lower monthly cost when you have more risk tolerance. You're willing to accept a higher level deductible to save on your monthly pocketbook. Some state based rules apply. For example, New York is one of the states that has a guaranteed issue rights, which means you can switch Medigap plans each year in and out with no concern because you have a guaranteed right. Other states, if you want to change from one Medigap plan to another, you may have to undergo underwriting, which means taking a form to your doctor and having a physical done. And depending on your health status, depends on whether or not the new company will accept you as a client or not. So, knowing if your state has guaranteed issue rights or if you're facing underwriting is an important question about whether or not you can change Medicaps. And then again, the Plan F has a age-based restriction where you have to have been 65 by 2020 in order to qualify for that one. So here at Caribou, we want to do side-by-side comparisons. I mentioned to you in the very beginning, how do I compare one plan to the next? Well, this is how. We have 3 new Medigap options and a client who had a Plan F. They were already on Medicare and already on a great Plan F, and they just wanted to see what was available, what was out there. We're showing them an Allstate Health Solutions Plan G in the first column. The second column is a Blue Cross Blue Shield Plan G. The third column is that Allstate, but a Plan N this time. So it doesn't cover those excess charges, but it is slightly cheaper. And then you can see their current plan on the far right side, a Blue Cross Blue Shield Plan F. So they're paying, you can see it, sorry, I should say the plan type is listed. The rating is listed. These are all A-plus plans, so they're all equally rated. But the monthly premium, this client is paying $172.03 a month. And you can see the other plans. I mean, the Plan N is quite a savings if you're willing to face excess charges. If you want the more comprehensive Plan G, he could still save money, he or she, by switching into either Allstate or the Blue Cross Blue Shield Plan G. The very bottom, we have some totals in pink. What are the annual costs of this plan? So if you take that monthly premium, multiply by 12 months in a year, what does it cost just to buy this plan in a single year? What is the premium plus that $226 deductible charge me? And what would the difference? What would I save if I switched? This is one way to compare plans, is to consider just cost alone. What's cheapest? And that's a great side-by-side comparison. Part D, drug plans. So this is, I mentioned that menu where you're going to pick different pieces to configure your whole meal. Another piece is getting a prescription plan to cover your drugs. Standalone drug coverage is supplied by private insurance companies. They have a premium, and they also have that IRMA, income-related monthly adjustment amount based on your income looking 2 years back. At the moment, there's no cap on drug costs. So if you are taking a very expensive medication, this is a place you really want to pay attention to because it can really affect your annual budget. Medicare is always changing, though, always new things coming down the pipeline. This is the implementation timeline of the prescription drug provisions in the Inflation Reduction Act. Now, the Inflation Reduction Act was only recently signed. It was last year, or actually, I think the end of last year. It was implemented in 2023 to start. 2025 is the important one where you're going to see a cap on drug costs come in for the first time ever. There's going to be an out-of-pocket maximum of $2,000 per person. So that's a huge, relief for clients who have huge expensive costs that go above 2,000. They're going to be capped at that amount, and the insurance is going to cover the remainder. So that'll be a huge relief for a lot of patients with expensive, costly drugs. From 2026 onward to 2029, the government is actually going to try and institute negotiated prices for certain high cost drugs to see if they can further reduce the costs and impact of drugs in the United States. Let's talk about the donut hole for a minute. And after the drug plans, I will stop for a minute. I'm seeing quite a few questions popping up, so that's great. The donut hole is something, if you've been familiar with Medicare, you might have heard of it before, but the drug prescriptions work a little bit uniquely. Before the first phase at the very top, before you've reached your deductible or the donut, you're going to pay for 100% of your drug costs, your prescriptions, when you pick them up at the pharmacy. So if you have a $500 deductible and your medication is $100 a month, you're going to pick that up 5 times before you've reached your deductible. Once you've reached your deductible, both you and the insurance share the responsibility of paying for your drugs. At this point, you're going to notice your costs drop dramatically. You might have a flat rate copayment. It might be like a flat $5 or $10 when you pick up your drugs. It might still be percentage based, but it'll be a smaller percent, and the insurance is going to pay for some of your medications. When you reach the donut hole, you're going to pay a larger percent of your medications, no more than 25% of the cost. But if you were paying like a flat $5 copayment, you might notice that it goes up to 20 or 25%. Each plan is slightly different, but you will pay a larger portion while you're in the donut hole until you reach the coverage gap limit. And that's when you move into that fourth and final phase, which is something called catastrophic coverage. But essentially, when you've reached a large, expensive amount, you're going to be capped at paying no more than 5% of your drug costs for the remainder of that year. So, because of this, people might experience fluctuation throughout the year. In the beginning, January, February, March, maybe April, May, while you're working towards your deductible, you're paying everything. Then your costs are going to go down dramatically for a few months. If you enter the donut hole, they're going to go back up for a few months. And then once you reach catastrophic coverage, they'll drop back down. Some people never get as far as catastrophic coverage. They stay in the donut hole. Some people never even reach their donut hole. It depends on how many medications you're taking, the cost and the coverage of your medications. But because of this fluctuation, it's really good to plan out your medication costs by each drug, each prescription. What does it cost? Is it covered? And when do I expect to reach those costs so that you can plan out, when is my donut hole arriving? How long will I be in it? What are my costs going to fluctuate up and down? Especially if you're on a fixed retirement income, it's really important to know when these phases are coming for you, so that you can plan accordingly. This is an example, again, a Caribou example of where we have compared side by side drug options, same as the Medigap. On the far right side, their current prescription drug plan from Blue Cross Blue Shield, and 3 potentially new options: a WellCare cost-effective option, a $0 deductible SilverScript Plus, a recognizable carrier with Humana. You can see in the star rating, which is the second line down, that their plan is actually the lowest rated plan option that we found. You can see in the premiums, there was one plan that was much cheaper monthly, $10.70, compared to their plan on the far right-hand side, which is $29.80. But there was also a $0 deductible option, the second column in, that had $79. So they'd be paying more out of their monthly pocket, but no deductible. So it's good to kind of look at these and weigh pros and cons. Do I want to pay more in my monthly premium and not have that deductible and that fluctuation? Or would I rather pay less and save my monthly pocketbook and deal with the Medicare fluctuations and the changes in medication prescriptions? You can see we verified their pharmacy CVS was in network across all of the plan options. And the second page is very interesting as well. The client was taking a brand name Flomax capsule, which was not covered under any of the plans, including the one that they were on. Their current plan was not paying for it. So we quoted the cash pay rates. This is what it would cost if you pay cash for your prescription under a non-covered basis. However, changing to the generic temozolin would offer coverage, and this is what it could cost you and what the savings difference might be by switching. And this is a great time to have a conversation with your provider about why you're on the brand name instead of the generic. Some providers may have a medical reason. Maybe you're allergic to something. There's a interaction with one of your other medications that makes the generic dangerous, where the brand name is not. It could be efficacy. Maybe the generic is not proven as effective for treating your particular condition. Any of these medical reasons are great reasons to file what's called a formulary exception, which means your doctor reaches out to the insurance with a letter saying there's a medical reason to take the brand name, and we're requesting an exception to have the brand name covered for these medical reasons. Formulary exceptions are very common to be requested and reviewed, and they're reviewed on a case by case basis, but it could potentially bring you lots of savings in the way of coverage. Alternatively, if your doctor has no preference over generic versus brand name medication, you could potentially make the switch and save yourself a lot of money if that was an option available. So, these kind of comparisons and this level of granular detail are important for full comprehensive drug coverage comparison and planning. So I want to look at one case study we had here at Caribou. A client was looking for new drug plans, never went to Medicare before, and had found one that she liked. The SilverScript Smart Saver RX on the far right side had the lowest premium. She said it's only $7.20. And if you look at the middle plan or the far left plan, you can see it is quite a savings, $38 versus a $73 premium or $7.20. However, just picking the cheapest premium isn't always wise. If you look at the circle, we've highlighted the estimated annual drug costs, again, based on this client's very specific medication list, and found that that company, while it's only a $7 premium, was going to charge $40,000 in prescription costs. The two part opposite options on the left and middle side, they had more expensive premiums, but the drug costs were much more reasonable. So you don't just want to rush up and pick the cheapest plan based on monthly premiums. You really want to look at your expected drug costs and see how that interplays along with the premiums, because it's all intertwined. It's all working together. So one of the major questions we get at Caribou a lot, do I need to enroll in drug coverage, especially if I'm not taking any prescriptions at all? And the answer is sadly yes. Most often that is the case. If you're not taking prescriptions, you may just pick the cheapest possible plans. If there was no drugs involved in this scenario, I would definitely say the $7.20 is the most economical choice. If you receive a prescription mid-year, you can always change next open enrollment. But you don't want to have late enrollment penalties, which are assessed if you do not have active prescription drug coverage after the age of 65. So, in order to avoid that, you should enroll in some type of prescription coverage. Now, you can waive Part D if you have other credible coverage sources. So, that includes TRICARE, VA coverage, or if you or your spouse are still actively working and have access to employer coverage with prescription benefits that cover your medications, you could waive your Part D and take those instead. Also, Medicare Advantage plans often have coverage built in with them. I'm just quickly scanning our comments here to see if there's any questions I should address. So there's one saying, I've applied for Part A and Part B. When can I expect to receive the confirmation that I'm enrolled? Oh, and then it goes on to say, do I expect the government shutdown to impact Part B enrollment? Great question. I've actually been watching the shutdown news very intently, Thomas, because I'm also kind of intrigued. It's always a question. How far are they going to take it? Are they just pushing it to the last minute to get a better negotiation? Are they actually willing to take this into shutdown? And how far does it extend? I will say when the government closes down, they close down non-essential services first. Essential critical services do still remain, but even at that point, there is levels of degrees. Everything gets downsized. So within a department that is essential, you may still find non-essential staff are sent home. So in short, regardless of what if the shutdown happens of any form, regardless of whether or not Social Security Administration is actually affected, I will say everything will slow down, even if you're in a critical essential service. But the likelihood that Social Security Administration Medicare enrollment is one of the non-essential services, I think is pretty likely, and I think we are going to notice delays because of that. Typically, we have been told to quote 3 to 4 weeks for your Medicare ID card, your red, white, and blue card to arrive. That being said, as of late, I have been getting client reports that it took closer to the 5 week or 6 week mark. That there has been, and I don't have any official comment to say that Social Security Office is changing their quoted timeline. But what I will say is, anecdotally, from the reports that I've been getting, it's been taking longer than the 3 to 4 weeks that is quoted on their website. So let's all maybe plan for the 5 to 6 week mark and cross our fingers. But it can take some time for that card to arrive. That being said, just because the card hasn't physically arrived in the mail, you can potentially start your enrollment into a Medigap or a Medicare Advantage or a drug plan. I'm jumping back and forth between my two sides, but you can potentially get those other pieces even without your ID card. If you're working through a broker or you're going onto Medicare.gov, you can speak with them over the phone, give them your name and your social security number, and sometimes they will actually pull it up and say, "Oh, your number's in the system." Maybe the card hasn't physically arrived yet, but the system part has processed through, and they might be able to see it. From September 24th to today, which is the 27th, there's no way your number's in the system yet, but give it 1 week or 2 weeks and you can try that method if you're eager to get the other pieces underway so that you don't have to wait the full delivery time for your card. It's a great question. So I think that's our only one in the main chat. We have lots of comments going around, but I will continue to address questions as they come up. So Medicare Advantage. So this is a perfect break as well, Thomas. We just finished the left-hand side where you can configured all of these pieces to create your menu. Now I'm going to go on to part C, that Medicare Advantage, where it's all rolled into one bundle. We're going to have our prefix dinner theater where everything's combined for us. The nice thing about Medicare Advantage is one ID card, one customer service number. When you log on, one website to go to. So it's a convenience in having it together. This will include Part A and B, your hospital and your professional Medicare coverage. They often include Part D, prescription drug coverage, and they are approved by private insurance companies. The drug coverage works exactly the same as an independent standalone Part D from the first option. There's no cap on the maximum out of pocket, and they can often cover similar medications. They have their own formulary lists, but the medication coverage will be similar. There's a donut hole with the deductible and then shared coverage and then that gap in the middle. So it's the same process. Often Medicare Advantage is cheaper. And if you see an ad, maybe on the nightly news or on the bus stop or billboards as you drive along town, if it's for Medicare Advantage or Medicare, you're probably looking at a Medicare Advantage plan because these companies, since they are independent companies, they like to advertise their products and show them. So you very rarely will ever see an advertisement for like Medicare Part A and B. The government doesn't really advertise. It's just there. But the Medicare Advantage, you'll see adverts for around town. They can be cheaper out of your monthly premium and pocketbook. And so that can be very enticing as well, as to consider Medicare Advantage price if you're looking at being cost effective. One major difference is that you can require pre-authorization or pre-approval to get certain services, and you may need a referral to see a specialist. The other very significant difference in Medicare Advantage is that because you're signing up through a company, independent, like Blue Cross Blue Shield or United or Cigna, you're going to look for doctors in that network. So doctors who accept Blue Cross Blue Shield Medicare Advantage or Cigna or United. So the networks are more limited than original Medicare, which is nationwide, all 50 US states. So some people find those networks are more restrictive. Other people will say, well, I've always been with Blue Cross Blue Shield doctors when I was on an employer plan. So staying with Blue Cross Blue Shield Medicare doctors is not really very restrictive for me. So some Medicare Advantage plans will offer perks. I like to call these like sprinkles on your ice cream sundae. So if you have an ice cream and you put the whipped cream and the sprinkles and the cherry on top, these are designed to encourage you to pick their plan over a competitor. So Anthem Blue Cross might say, pick us, not United, and United might want you to pick their plan over Cigna or Aetna. So these perks can include vision coverage. Dental services like maybe routine cleanings or checkups might be included. Hearing aids or exams are covered. Fitness programs like gym memberships, sometimes a Weight Watchers membership. They may even pay for transportation to and from doctor visits. If you had to take a taxi for a doctor visit, they might be able to reimburse if you submitted receipts. Some offer over the counter medications or vitamins or coverage for well being. Debit cards to purchase healthy foods is one we've seen occasionally. Help paying for your utility bills, and access to brain games or other exercises for good mental health. So, all of these perks or sprinkles on the ice cream sundae are designed to encourage you to choose their plan. Every company offers different perks, different kinds of sprinkles, different kinds of flavors, but it's up to you to decide if that's something that really makes Medicare Advantage appealing to you or something you probably wouldn't use very often. So, this is a case study of a client who was on a health plan and they really wanted to stay with this carrier. I remember speaking with them, and their example was, I've always been with United. I've been on the same employer company and the same United health plan for 30 years. So, when I go to Medicare, I want to stay with United. So, again, 3 plan options compared side by side, and their carriers in the middle. There was 2 other options from other carriers: an optimized provider network, one that included more of their doctors, and a low exposure option. Unfortunately, their carrier was the lowest rated, 3.5 stars out of 5, instead of a 4 or 5-star rating. Their maximum exposure, the next red circle in the middle there, was also the highest, 7,550. And what's worse, and the shocking thing, was none of their doctors at the very bottom circle there were covered in network. So it's very important. Doctors can contract with health insurance companies on a case by case individual plan basis. So as a doctor, maybe Dr. Smith could say, I'm going to take Blue Cross Blue Shield employer plans. If you work through an employer job, that has your coverage for PPO plans only. I'm not going to accept HMO plans with an employer. I'm actually going to take United Healthcare for HMO plans. And when it comes to Medicare, I'll take Cigna Medicare Advantage, Aetna Medicare Advantage, but a Medigap plan or a prescription drug plan, I'm only going to take Humana or AARP. So, because they can pick and choose like this, I will say that's not common. Most doctors, for convenience and paperwork, will kind of align with 1 or 2 different insurance companies. But depending on the rates and the benefits that they get for being in network, you may find a doctor who was in network with your United plan and your employer is not in network with United for Medicare. And that can be shocking because sometimes people think, oh, yeah, my doctor takes United. He's always taken it. And that may not be the case for new plans. So it's important to, again, get very granular. My specific doctors, my specific medications, what does my healthcare look like with these different plans? Things to support that decision between those 2 options. Option 1, we have that menu where we get A and B plus a Medigap or supplemental plan to reduce our risk exposure, plus a prescription drug plan, all those pieces. Or I'm going to take Medicare Advantage, all rolled into one plan. I'm going to be loyal to that company's network and make sure I get doctors who are in network for Medicare for that plan. I'm also going to enjoy some of those sprinkles on my ice cream sundae. Maybe I'll have my free gym membership or get my vision checked up. So when you're trying to decide between these 2 things, risk tolerance. Am I willing to accept a higher risk in the event that I go to a doctor and I need to pay more money or a surgery? Or do I want a low risk, no financial surprises, no big bills? And what do I want for my fixed fees, my monthly fees? Do I want to pay a lot of money out each month to buy extra insurance and have peace of mind? Or would I rather save my monthly checkbook, spend my retirement traveling or golfing or knitting or whatever it is that thrills you and not spend a lot of money on insurance? You can talk about access to doctors and networks. Do I want to have a nationwide network where I can move or travel or retire in a different state and that will come with me? Or do I want to stay loyal to a particular company like Blue Cross Blue Shield, Aetna, Cigna, and make sure that my doctors are in network, a PPO versus an HMO plan? And then we can think about authorizations and denials as well. There is another question. If you sign up for Blue Cross Blue Shield Medicare Advantage plan, would the MD network be the same as Blue Cross Blue Shield private insurance network? No. Great question, Bruce. I think we probably answered that while we were going along, but it is different. And you have to check that Medicare plans, whether your doctor takes the Medicare Blue Cross Blue Shield Advantage instead of the employer or private insurance network. I wouldn't say that they're significantly more limited. I would just say that they're very different, the networks. So it's worthwhile checking, but I don't think they're smaller in size. Good question, Bruce. And there's also another one. I am 71 years old. I enrolled in Medicare at 65, but I'm still working and I'm using my employer's insurance. Great. So this is an example of someone who's delayed their coverage. Um, and should I move to Medicare when I retire or earlier? I am so glad you asked this. Employer coverage is not always cheaper than Medicare. We have had some cases, they are rare, but some cases where someone was paying out more in monthly premiums than they would be on Medicare. And had they just waived their employer coverage and said, thank you for the benefits, but I don't need those at this time, and they took Medicare, they would have saved money. So these kind of side-by-side comparisons are something you definitely want to look into, and you can reach out to your financial advisor and say, I'm interested in doing a comparison to make sure that your employer plan is still more cost effective than your Medicare options. If it is, stay on your employer plan until you're ready to retire and move to Medicare at that time. If it's not more cost effective, then there's a conversation. Is changing worth, like, if I could save $5, I would not change my health plan. I would just pay $5 more and not deal with the fuss. But if you told me, hey, you could save $1,000, now I'm thinking, what could I do with $1,000 more money? I'm thinking about the vacations I might take. I'm thinking about the Christmas presents I would buy. So that's when that conversation starts to become interesting and saying, is it worth it for me to switch? And can I keep my doctors, or how much of a switch? Am I changing all of my doctors? Am I changing all of my pharmacies and medications? Is it a lot of paperwork? Or can I still stay with, my same carrier, keep my same doctor, and it's very little effort or, work involved, and for a whole $1,000 worth of savings? So it's kind of a complex conversation that only you can really answer, as far as your preferences and effort tolerance. And that's a real thing as well. But it's definitely one worth having and worth exploring. These are great questions, you guys. Keep them coming. So, why is Medicare planning so important? And we're going to wind this presentation down and leave time for questions. Cost calculators do not work. This is an example of a major financial institution here in the US that offered, hey, we have a Medicare cost calculator, check it out. On their website, we put in the requirements. They needed an income, so we put $100,000 for a client, someone who lived in Pennsylvania, who had moderate healthcare utilization, and we asked for a Plan G. Those were the four things they asked for. It spit out a number, $6,894 a year, and told us the person was in 98th percentile. That same client, running through a Caribou analysis where we got very granular, what are your medications? What are your doctors? Let's look specific. Found a retirement income of $100,000, lived in Pennsylvania, same criteria, moderate healthcare user. And we saw in that circle down there at the bottom, their annual expenses were $25,000. So if you've done a cost calculator and said, I think my Medicare is going to cost me around $6,000 or $7,000, you could be in for a surprise if you didn't look at your estimated drug costs and your annual expenses. Individual costs, remember those two forks that I keep doing? Original Medicare on the left, with the Medigap plan, with the prescription drug plan, 3 pieces to your menu. And on the right, Medicare Advantage. It all rolls into one plan, but you have a Part B, an out-of-pocket maximum, and your Part D IRMA. And then at the bottom, that worst case financial responsibility. in the event that I have a huge healthcare year, what is my biggest financial exposure? And looking at these numbers side by side will help you compare costs and make a choice. There's opportunities for savings. Last year, our company Caribou, with clients from like BLBB, offered these analysis and we identified savings. This is a per person average, but on average, the clients who came through open enrollment last year saved on average $401 in premiums, $23 in prescription drug plan premiums, $374 in their actual prescription drug medications, and potentially $2,829 that could be tax deducted. So how do I pick optimal coverage? I have all these options and all these things swimming around. Preferences are everything. It's a very self-reflective experience going through Medicare planning. But you want to ask, of all of these preferences, your doctors being covered, a recognizable health insurance company, a low monthly cost, a low financial risk, a plan with a high rating, what preferences do you have? Some people preference experience. I want to keep my doctor. I love my doctor. We've had a great relationship for 20 years. She knows my whole health history. I do not want to change doctors. That is a priority. Could be, I want a highly rated plan. I want a plan that's really 5 out of 5 stars. I want a company that's recognizable, name brand company. These are all experience factors. The opposite side is cost. I really can't afford a lot. I'm on a fixed income in my retirement. I need the cheapest possible health care plan. That doesn't always mean the cheapest premium, but sometimes the cheapest financial exposure or the cheapest risk because I have no risk tolerance for scary bills. So depending on what you prioritize and what preferences you think are most important can influence the plan you choose. And you're getting sick of these charts, but here are 3 plan comparisons side by side. If you want one that covers all of your doctors, the first plan is optimized provider coverage. If you wanted a PPO plan, all 3 of them are, but you can see where they show the second bubble down shows the PPO. A recognizable insurance carrier would be that second Regence Med Advantage plan. Or if you wanted a plan that had a great high rating, was highest rated company, you'd pick the last plan because it's 4 out of 5 stars, 4.5 out of 5 stars. It also has the lowest exposure, the lowest financial risk. So you can see how prioritizing doctors or financial risk might lead you to pick one plan over the other. And then this is an example of how one analysis differs from the next. So you have a side by side for 2 people here on the left and on the right. And I want you to look at the first circles, the $226 deductible or out of pocket on the left and $7,500.50 on the right. And the next version, the first column is the same, but the second column is dramatically different. And when you look at the last circles, worst case financial responsibility, on the first you have $9,400 and change. The second column is $8,500 and change. And as we switch to a different client, those jump to $11,000 and $15,000. So these are 2 entirely different clients with different situations, and you can see the numbers change a lot. Oh, beg your pardon, I'm going the wrong way. The cost savings, again, this is an example of someone who was on current coverage on the far right side with Anthem Blue Cross and an employer plan. I'm glad this is actually perfect for one of our questions that came up. This person was on an employer coverage past 65 and never took Medicare. But you can see that monthly fixed fees, they were paying $3,180. And if they switched into Medicare, either of their monthly fixed fees circled on the first column or the second would have been cheaper, saving up to between $33,000 and $36,000, depending on which column they chose. And their financial risk would have dropped down under $40,000. So huge potential for cost savings. Even if you're on employer plan, you never know if Medicare will be more affordable. So let's talk about next steps. Open enrollment runs from October 15th to December 7th, so you can enroll into Medicare or make changes. If you're on a Medicare Advantage and you want to change to a different company, if you want to change your drug plan, maybe new prescriptions are costing you more than you expected, it's important to make these changes. In 2020, 79% of Medicare Part D enrollments did not revise their drug plan. 89% of Medicare Advantage did not revise their drug plan. And hopefully we've shown you it's very important to review and potentially switch, drop, or change coverage based on your situation. There is an extended Medicare Advantage enrollment period, January 1st through March 31st of next year. If you want to change Medicare Advantage, or if you're on an original Medicare and you want to go into a Medicare Advantage, you can consider those changes. It does not allow you to change drug plans, and it does not allow you to change from one Medigap to the other. It's kind of unique to Medicare Advantage. So, what I would say is this period, October 15th through December 7th, is everything. Think of November. November is the prime date. November, remember November is when you can change everything. But if you needed an extended window, you could have that for Medicare Advantage plans. And with that, I'm going to switch over into some of our questions. Great. So Bruce asked, when you're talking about rating, what exactly are you rating? Financial stability or customer satisfaction? Uh, and it could be both or either, depending on what you're looking at. A Medigap plans are AM Best rating, and this strictly looks at financial stability. In the event that all the clients had a significant healthcare year and required claims to be paid in 1 year, what is the strength or financial standing of that company to be able to pay their claims? Sort of like if you remember from history class when we learned about the depression, the financial depression of 1929, and there was a run on banks, and the banks couldn't afford to pay out all of the money from everyone who was trying to withdraw, and that's what caused them to collapse individually. Similarly, if everyone has a run on healthcare claims, will this company support that or will they collapse? And the AMB ratings are lettered A, B, C, D, F, just like your grades at school. While we never show D, C's, or B's, they do exist. Caribou usually focuses on the plans that are A rated or better, that have a good financial standing. The star rating that you're going to see for Medicare Advantage or for drug plans incorporate not only that aspect, but more specifically customer service, customer satisfaction, number of complaints filed, number of appeals, number of concerns raised with the Better Business Bureau. So it has a lot of components that go into a comprehensive, and that's a stars, 3 out of 5 stars, 4 out of 5 stars, 5 stars being great, 1 star being terrible. Good question. If you sign up for Blue Cross Blue Shield Medicare Advantage, oh, and I think I answered this about the networks, and they are different from private networks to corporate ones. So I believe I've gotten those. Let's go through some of these as well if we have some time. I see lots of questions coming in, so this is great. Are Medigap and Part D the same? No. A Medigap is for medical coverage, and the Part D, or D for drugs, is the easy way to remember it, is prescriptions. Those are 2 different pieces that you will pick from that menu of choices to configure the left side of the Medicare. But they do run differently. And so if you were, you remember that fork, if you were to take the left, you're going to have 3 ID cards: a red, white, and blue card for A and B Medicare, a Medigap card, which kind of covers the same medical services as A and B, but it fills that 20% gap, give you that extra assurance and less risk tolerance. And then finally, your prescription drug card, which is the only thing you'll ever take to the pharmacy when you go to pick up your medications. And that's for prescriptions only. Good question. How do you know if the Medicare Advantage plan includes Part D drugs? Well, there's a filter button. When you're looking for Medicare Advantage, you can say include drug plans or exclude. If you have VA benefits or TRICARE benefits and you're getting your prescriptions through there, you may choose a Medicare Advantage plan specifically that doesn't have drug coverage because you don't need it and you have credible coverage, and that could reduce your monthly cost. However, if you do not have credible coverage through anywhere else, you always want to make sure you click the button to include drug coverage and make sure your hand does. If you're not sure when you're enrolling, ask on the phone. I need to make sure this has drug coverage included. And Caribou will always delineate and clearly mark whether it's covered or not. Since Medigap and Part D are different, the question is, can they be offered by the same carrier or different carriers? It's a great question. Always, you can get any carrier, and you may find Blue Cross Blue Shield does drug plans and Medigap plans, for example, but you don't have to take it. You could take a Blue Cross Blue Shield for one and United for the other, because they're 3 different menu pieces that compile your configuration. You can pick and choose the companies that you want to work with. There is no benefit to taking all the same company. You would think there'd be a great discount. Like if you do all Blue Cross Blue Shield options or all United options, you're going to get discounts, but that is not the case. The only type of Medicare discount that I'm aware of is in a Medigap plan, which is that supplemental coverage. You can have a household discount if you and your spouse or partner enroll in the same plan. And some people offer it, some people don't. And that's something you want to look for in the filters when you're looking at Medigap plans to see, oh, does this have the um, household coverage? So if you have a family member that is in home health care, is that covered? Yes, with limitations. Home healthcare has limitations to the number of days and types of services that are covered under Medicare. So it's a pre-approval basis. Your home healthcare agency would need to write in and say, this is what we're treating and for how long and for what. It does not cover long-term care. So if you're having a support nurse or staff or someone who's coming and looking after a loved one for long term, that's not just a temporary rehabilitative services, that would not be covered. And that's when you would want to look at long-term care insurance. Good question. We do help, does Caribou, sorry, I'm not reading these questions out, but does Caribou help look at the providers who offer Medicaps? And we do. We don't actually sell the plans, but we will do a comparison analysis with costs and benefits side by side and help you choose the company that you want to go with. But we will not actually do the enrolling. That is up to the client or to the individual to enroll. There's another one from Emily. Does PPO mean that any provider in a geographical area is available? Good question, and sadly, no. Not under any coverage, not employer plans, private, Medicare. PPO means it is the largest network available, but it doesn't mean anyone is covered. Another unique factor about PPO is that they offer in and out of network benefits. So for in network, they have a select network of doctors who work with that insurance company, like United or whatever. But if you wanted to see a doctor out of network who didn't contract in network, you could have some limited coverage. But it doesn't mean any doctor anywhere. That coverage can be as little as 15% or 20% of the coverage for the bill. And they can have restrictions that it must be a covered service. So your chiropractor may offer acupuncture benefits, but only the chiropractic care is covered. The acupuncture services would not be. So people think PPO is kind of like a blank check to go anywhere, and it's not. It's a more flexible check. It allows the flexibility for you to choose out of network doctors and potentially expand your network to a larger area, but there's still restrictions that apply for covered services and restrictions in cost. So great question. We're almost running to the end here. I want to make sure that I've gotten through everything. So I'll double check if there's anything else. Good question about each member. Does each member choose their own coverage, or do you have a better price if you sign up for a couple? I briefly touched on that there's a Medigap household discount. But outside of that, for drug plans and for Medicare Advantage, there's no difference. You sign up for whichever plan is uniquely individual to you. This is actually really great if one member of your household has a lot of services and medications and one member does not. You can pick entirely different plans that suit you individually, and it can actually be very convenient that way. Is there a deadline to enroll, and how far ahead of that deadline do I need to call my advisor? Great question to introduce Caribou and do an analysis. Your initial enrollment for Medicare is around your 65th birthday, 3 months prior, the month of your birthday, and 3 months after. So that's your enrollment window. But we have people who are coming to us 2 to 3 years before their Medicare eligibility when they're 63, 64, and planning and saying, hey, I want to know what this is going to cost and what this is going to look like. So there is no time limit or deadline to reaching out and getting an analysis done. I would say the last minute procrastinators might wait up till 2 weeks before their final enrollment. But those are the people who tend to be a little more urgent and under pressure. So I would not encourage waiting until the final 2 weeks. So that's us at time, everyone. I will say these slides are going to be available We will send them out so that if you have questions, you can reach out to your financial advisor to start a Caribou analysis. And they can also send the copy of the recording to you if you needed to watch it or share it with a partner who wasn't able to attend. Thank you
Thank you
all
so
for
much,
coming.
Clarice. Oh, I didn't mean to cut you off
No,
there.
go ahead.
Thank you so much, and thank you for Caribou for partnering with BLBB. As Clarice has mentioned, if you would like to get started with Caribou, please give your financial advisor a call. They are basically your door to your introduction to Caribou. And you will get a recording of this program so you can go back and just check out all the amazing information that Clarice so expertly navigated through. Thank you all and have a great day.
Thank you. Take care.